Okay. Dr. McConnell, I've asked you to make this video with me. About a year ago, I was getting my annual checkup from my cardiologist, Dr. Randy Lombardo. And I told Dr. Lombardo that would he be interested in doing a study with his staff on Helena's various LPA methods and other novel cardio markers. You would like to just comment on the data that we generated on these 36 patients?
It would be my pleasure. And Helen has developed two very good methods for LP little a. They have an LP little a cholesterol method and an LP little a particle method. We're going to focus on LP little a cholesterol today because that is an FDA approved assay and it is available for any commercial laboratory to utilize, so any hospital laboratory and other place. So I'm going to share my slides. And the healthcare workers were the workers from Dr. Randy Lombardo's practice, which is called Beaumont Heart and Vascular Center. 36 of his employees participated in total. And again, all of them were apparently healthy at the time of this study was performed. So we did a number of biomarkers, but we're going to focus this presentation on LPA cholesterol. And this is how the risk was developed. The guidelines say that the risk marker for cardiovascular disease is LDL cholesterol. And just looking at that LDL cholesterol, there were a significant number of who were at increased risk. 15 of the 36 were completely optimal. There were 17 that were at borderline risk and 4 patients that were at high risk. If, on the other hand, we look at LP little a cholesterol, we have optimal, borderline, high risk, and very high risk levels. LP little a is the most atherogenic lipoprotein, being an inflammatory lipoprotein that's easily oxidized. And what we found was 25 of the 36 individuals had optimal LPA cholesterol. 3 had borderline risk levels of LPA cholesterol. That's very consistent with what we've seen in all the literature studies. 1 in every 4 to 5 has high LP little a. It's a genetic risk marker. You typically either have it or you don't. And so knowing if you have high LP little a cholesterol can tell you if you have increased risk that you don't otherwise determine by doing a traditional lipid panel. So this is just an optimal patient. The triglycerides, the total cholesterol, HDL, and LDL cholesterol are all normal. Also does not have elevated LP little a. This is the next participant we looked at, and these results are very high risk. LDL cholesterol is 109. And that's just in that borderline risk. And most physicians would look at this and say, you know what, your lipids look pretty darn good, but we can just monitor this just to make sure that this doesn't change. But right now, this is no risk. If, however, you look at the LP little a cholesterol, the LPA cholesterol was 22 milligrams per deciliter. That's a very, very high LP little a cholesterol. This is another of the participants also at very high risk, despite the fact that he has a completely optimal lipid panel. LPA cholesterol, 24 milligrams per deciliter, extremely high. These last 2 patients are patients that are at very high risk for developing coronary atherosclerosis and having major adverse cardiovascular events. They would not have known about it if we did not do the Helena LP little a cholesterol method. And so if we just want to take a look at overall what the difference is between measuring and not measuring LPA cholesterol, 3 individuals went from optimal risk to borderline risk. 3 went from completely optimal to very high risk for having a heart attack. 1 went from borderline to high risk. 3 went from borderline to very high risk. And 1 went from high risk to very high risk. Just by adding this marker, you can identify 1 in 4 to 1 in 5 individuals that you would not have otherwise identified as increased risk. If you identify it, there are things that you can do to minimize your risk. So please get your LP little a measured. Oftentimes, the first sign or the first symptom of a major adverse event is death. We found many individuals who have had high LP little a, didn't know about it, they had a heart attack or they had a stroke, and then later they measured and they found out their LP little a was high, and that was the cause of it. And had they known that, they could have done some things to mitigate the risks.